Cecile, Olivia Fresia.
Ramajan, Sifa is there already, but apparently she has problem with virtual background, so she might not have the virtual background because of
okay
problems.
It's okay if she don't use the virtual background. It's okay. It's okay.
Where is Candy and friends? Can we see your face, Candy? Oh, kebalik. Okay, Candy. Thank you, Candy.
So guys, we still waiting for the speaker, Miss Sifa.
She is standby. Did you send the link? Not yet.
What link? I don't have her number, brother.
No, okay, that's why. Oh, sorry. Yep. Sorry. Yeah, I sent her. Yep, I sent already the link.
Okay, thank you, brother.
No worries.
So guys, if Miss Sifa enter this room, we say we welcome her.
We greet her.
We greet her. I mean, yeah.
Yep.
Hi, Miss Huang.
Oh, hello.
Hello.
Hi, Miss Huang.
Hi. Nice to meet you.
Nice to see you all.
Yeah,
wow,
thank you.
A very interesting section. Lots of students.
So, Hung, I'm a bit weird because I used to call you Mama Hung, but I have to call you Hung now.
That's all right. Hi.
So, hi. So, for professional reason. So, the principal, where's the principal? Raise your hand.
Me.
Yeah, that's the principal, Mama Hung.
Yeah.
And then, where's the English teacher? Yeah.
Hi.
Okay. Students, all of you, you can turn on your microphone and say hi to Miss Hung. Go.
Hi, Miss Hung.
Hi. Hello all.
Hi.
Hi.
Hi, Miss.
Mama Hung, are they cute? Okay. Hello, Mama Hung.
Yep.
What do you think about our students?
Oh, I think they must be very studious.
Sure, they are. They are very studious. They're enjoying the quarantine time, also listening to music, watching movies and stuff. And Miss Sifa is apparently here.
Yeah, Miss Sifa already.
Hi, Sifa. All students,
Hi,
can you
Sifa.
greet Miss Sifa first?
Hi, Miss Sifa.
Hi, Sifa.
Hi, everyone.
Nice to meet you.
Likewise.
Okay.
Thank you for inviting me here.
Sure, we thank you. We all thank you because and also Mama Hung. We are thankful that you guys, you have. I know that you're busy, but you still have time for us to share your experiences and knowledge to our students. The main reason from this program is that to give exposure to our students so that they're be motivated to pursue higher education like you guys, and also to work abroad like Miss Eva and also Miss Hung. So Ramajan, floor is yours.
Okay. No, floor is Miss Eva. I'm sorry, my English very poor. sorry.
That's all right. It doesn't sound poor at all. Host, could you please Allow me to
Okay,
share my screen.
I already make you as a host. Go on, Miss Shiva.
Oh, okay, yeah. All right then. Yep. So, hi everyone. I am Assifa. So, before I start talking about our main topic here, talking about COVID-19, let me introduce myself first, tell you a little bit about my background. So, I was born and raised here in Indonesia. I grew up in Depok. Way back then in 2006, I was also just like you guys. I was also a junior high school student. I attended SMP Nurul Fikri, and then I move on. I continue to my senior high in SMA Negeri 1 Depok. After that, I went out of town. I went to Bandung where I pursue my bachelor's in biology in Institut Teknologi Bandung. After I graduated, I went abroad. I spent 1.5 years in Australia studying at Monash University with one of your teacher, Mr. Titus. That's when I met him. There at Monash, I specialize in biomedical and health science. Now that I've graduated, I am now in just a couple of days, I will fly out to Denmark to work for a Danish company called Novo Nordisk. There, I will work in medical affairs, where my job is basically to find out new ways on how to treat chronic diseases. I hope this little background about me will motivate you to sort of pursue higher education, because just like what you saw, it all started from young. It all started from junior high school, and then after that you can sort of develop yourself and expose yourself to many other experience by further education. Now, let's get to the chase. Without further ado, let's talk about how to stay safe from COVID-19. COVID-19 itself is a new disease. It is caused by a virus, what we call SARS-CoV-2. What this virus does is, this virus will enter our respiratory system. It enters through our nose, through inhalation, or through our mouth, and then it will go to our organ, mainly lungs. And then inside the lungs, this virus will infect our lung cells. Inside the cells, they will make copy of themselves, and then the virus will hijack our cells. The word hijack means that here the virus, they force ourselves to do something they're not supposed to do. In this case, the virus, it forced our cells to self-destruct and also cause more damage. And when our organs are damaged, our body can function properly. It will make us feel sick. In case of coronavirus, in case of COVID-19, when someone got infected, they might not feel the effect or feel the symptom right away, because it can take up to 14 days for the symptoms to develop. Even after 14 days, the symptoms of coronavirus, the symptoms of COVID-19 vary greatly, from no symptoms at all, what we call asymptomatic, to fatal. So some people will experience no symptoms at all. Some people will experience mild symptoms, flu-like symptoms. For example, they can feel feverish, high body temperature, they can experience coughing, or they maybe have sore throat. These are the mild symptoms of COVID-19. But some of the infected people, they may experience more severe symptoms such as difficulty breathing. And in these people needs to be taken care of inside the hospital. They need to be hospitalized because they would need machines called respirator to actually be able to breathe. Some of the infected patient may also experience very severe symptoms that will lead to death or fatal effect. And this is why COVID-19 is dangerous, because it can lead to death. So how does COVID-19 spread? The answer to the question is COVID-19 will spread from one infected person to another via droplets. Droplets are these teeny tiny bubbles of saliva that you sort of spit out when you cough or sneeze. These droplets can spread to the room. These droplets can transfer to other person. And even if you cough and cover your mouth with your hands, the virus will now be in your hands, be on your hands. And when your hands touches other surface, it will transfer the virus to the surface too. So COVID-19 can spread via droplets, or it could transfer via direct contact when you shake someone's hand if your hands are dirty, or when you touch your hands, you touch virus-filled hands to surface, and then other person touches that. It's called indirect contact. That's why it's very recommended to clean surfaces that are frequently touched, like door handles or maybe the button of the elevator, because those are the surface that's more have most probability or more likely to be touched by people and be contaminated with virus. And by this mechanism, that is how coronavirus or COVID-19 can spread from one person to many. So once one person got infected by COVID, it can start sort of like a chain reaction. So one people infect another one, or maybe another two persons, and then so on. And that's why it can spread worldwide right now. The spreaders are mostly the ones with no symptoms or mild symptoms, because they are more likely not aware that they are carrying the virus. If you have severe symptoms like difficulty breathing, you probably stay at home or in the hospital, right? But if you somehow infected but have no symptoms, or just a little bit dizzy, a little bit feverish, you might unpurposefully spread the virus to others while you're walking outside. Now, do we have a cure for COVID-19? The answer is currently, sadly, not yet. Currently, there is no cure for COVID-19, but this doesn't mean the fight is over. We are still fighting against COVID. We're in this together, and we all have a part in battling COVID-19. For example, there are scientists that currently are working on new medicines and vaccines. The difference between medicines and vaccines are medicines is used to treat people that are already infected. So if someone's sick of COVID, then they will be given medicine to treat it. Vaccines here, the function is to prevent infection in the first place. So Medicine is to treat someone that's already sick. Vaccine is to prevent someone from getting sick. And now this is still in process, and it may take a while. It may take months to years to actually develop proper medicines and vaccines. While we wait for that, we also have frontline healthcare workers. These are your doctors, nurses, surgeon, pharmacists. They are the ones that perform life-saving procedures. So even though there is no cure for COVID-19 yet, there are technologies, there are medicines that can help alleviate the symptom. The word alleviate here, it means to make something less severe or to make something less worse. For example, when someone have high fever, doctors can give the medicines to lower the body temperature. Or if someone have difficulty to breathe, doctors can perform some procedure to help the patient ease up on their breathing. So we got our scientists, we got our healthcare workers. What do the rest of us do then? What can we do to help fight against COVID? We need to play our part. Now, before I actually talk more about what can we do, I want to hear your opinion first. I want to know, what do you do to stay healthy? So students, please go to www.menti.com and enter the code 7820251.
All students, do you use your computer, laptop, or your cell phones? Then you have to go to menti.com, www.menti.com, and enter the code, and we'll have a little quiz, and then we'll give you, presents at the end of the sessions of this class for those who have best answers. So please now go to www.menti.com and enter the code. Ms. Assifa, maybe we have to wait for a moment for them to enter.
That's all right. Totally
Thank you.
fine.
Somebody is singing.
It's a nice voice.
Right. It's a nice
voice. Okay.
Wait. Ramajan, can you check the students if they are already, if they already entered the quiz? Can you ask them? Ramajan.
Hi.
Oh.
Hi.
Do you think they already entered all the quiz? You know, I mean, all of them, they entered the quiz already?
We can
I
see
can
in the
see
screen.
no one,
Oh, okay.
no one
Yeah.
yet. No one yet submitting answers.
Oh, okay. I'll submit answer.
Yes, give an example.
Yep, I will.
So go to menti.com and use the code. Okay, good.
Oh.
Eat well, sleep tight,
Sleep tight.
relax.
Oh, that's good.
Exercise. That's very good. Anyone else? Remember, there will be a prize.
Maybe they forget to put their name in there.
Oh yeah, to put your name.
Oh yeah. Don't forget to put your name.
Don't forget to put your name on your answer, guys, because there will be a present for you.
Prize.
Oh yeah. How about for those who already entered the quiz? Like somebody answered
it again.
Okay. Yeah,
okay,
just to
good.
yeah.
Good, Devanya.
Wow, that's a good opinion.
It's a complete answer.
Yes.
Very good.
Yes.
Oh, Zefanya.
I'm gonna eat healthy food like vegetables, and I will take vitamin C. If I go out, I will wear mask and I will bring a hand sanitizer. I do social distancing. That's so complete.
Yep, yep. Another one, Jessica. Staying at home. Yes, that's very good.
Miss Hung, you can also follow the quiz. We'll give you some gift also.
My first answer. The first answer was mine.
Oh, it's you.
It's all about eating and food.
And I don't hand wash. I don't hand wash.
Eat well is her first answer.
Right, right.
Eat well.
Yes, to combat the virus.
Yeah.
And I think that I forgot to say that I need to laugh.
Okay.
Okay, right. Physically active. Good.
That's so good. That's a good answer.
Yeah.
Ramajan, you never told me that your students are so smart.
Yeah, they are.
They are so smart.
Eat well, sleep enough, do sports. Good, good. Yep. It's very good to adhere to all health protocols.
Ramajan, wow, their English quite good. They use some sophisticated term like adheres to all health protocols, complies with all government regulations. Good, really good.
These are all very good answers. I feel like my job is done. What am I even doing here?
I'm so surprised. They are so good. I'm surprised, honestly. Exercise, eat nutritious.
We already have 10 answers.
10 answers. How many students we have here today?
We
They
have
about
here
20
today
something.
Okay.
23,
29.
29. Oh, 29. Yeah. Are we still waiting or?
Are there any others?
Oh, yeah. Any other? Oh, 11.
yeah.
Yeah.
11.
One new one.
11, okay.
From
I'm just gonna give another minute, and then after that,
Yep.
we
Right,
can
right.
move on.
Right.
Pardon me. Candy wants join us, but Candy,
Has a problem.
yes, Candy has a problem. Something
Okay.
like this one.
So
Oh,
she, okay. She
How to
can
submit
also
it?
submit the answers in the group chat.
Some students have a problem like this one.
Okay, I'm not sure what happened.
I don't see their in waiting room, so I cannot admit them to enter our meeting, our Zoom meeting room.
Or Candy has a problem with the what is it? With the,
Yeah, device.
phone. Yeah,
The phone, yeah.
device. Yeah. So
Device.
yeah, that's all right.
Okay.
Unfortunately, but
Okay.
that's all right. Yeah. So 14 answers.
14 good answer.
Yep.
Good. Nice.
Okay. Okay.
Shall we continue?
Go.
Or do
go.
I pick now?
Well,
Yeah, you can
pick now. Yeah.
I'm going to pick the first one that gave a very nice complete answer.
Okay, from Zevanya.
From Zevanya.
Wow, congratulations, Evanya.
Congratulations, Zevanya. Where are you, Zevanya?
Thank you.
Yay!
Yay.
Yeah, finally.
Finally.
Okay. Yep, this is just a warm up. Let's go back to the presentation. Right. Okay. So, the first and the best thing we can do to stay safe from COVID is to just stay at home. It may sound so simple, but that's the most effective because by staying at home, we are actually breaking the chain of infection. We are protecting ourselves from virus exposure, and we are also protecting others by not spreading the virus even further. So staying at home is the best way. Now, staying at home doesn't mean you just lounge on the couch or on your bed all day long. We need to keep our diet healthy. We need to eat healthy foods and also do exercise. Just like what some of you mentioned in the answers Menti earlier. So we need to have a balanced diet of carbohydrates, proteins, fruits, vegetables to keep our body fit. And we also need to keep our body active. We need to keep moving. We can do home workout. It could be anything you like. It could be yoga. It could be doing some push-up. Could be doing some sit-ups. It could be dancing around in front of a YouTube video, a K-pop dance or whatever you like, whatever your choice is. The most important thing is to just move around. Another option, and if you want to make your parents even happier and prouder of you, you can help them with chores. Do some house chores. It doesn't look like you're exercising, but actually it takes a lot of energy and it's good for your health. You can help mopping the floor, sweeping the floor, change your bed sheets, dust the desk, whatever chores that is in your house that keeps you moving around and keeps you active. That is good. And if you want to be a little bit more social, you can still play sports, but keep it with your own household members. It could be with your parents, mom and dad, or with your siblings, your sisters, your brothers, and keep it in an empty space. It could be in your garage, in your backyard if you have it, or it could be on an empty street in front of your house. The point is, as long as it's not crowded, as long as it's an empty space, you can still do play sports together with someone within your household. Okay, and after that, of course, we need to have a good personal hygiene. The coronavirus, it's very hard to fight them once they're inside our body. It's very hard. We don't have the cure yet. But when it's still outside, it is very easy to combat them because actually the outer layer of the virus is made of fat. So it's very easy to dissolve them with soap and water. That's why proper hand washing is very important. You cannot just rub your hands for some seconds and just go. You need to do it properly. You need to make sure that you wash your palms, back of your hands, and also scrub your fingernails between your fingers, your thumbs, and also don't forget about your wrists. If you do this properly, you're good to go. Another thing that some of you mentioned is just to shower. It's a good way to keep personal hygiene. And this is especially important after you went outside. So if you went outside, Once you go back inside, you need to take a shower and remove your clothes, replace it with something clean. Just in case there is a virus somehow managed to make contact into your clothes or into your skin, just to be safe. Another note on personal hygiene is to practice a good cough and sneeze etiquette. So the right way to cough and sneeze is to cover your mouth so that you're not spreading the droplets around. But do not cover it with your hands, because if you cover it with your hands, the virus will be on your hands now and it could spread around. And even it can reinfect you if you touch your own face with the dirty hands. So the good way is to cover your mouth with either the upper arm or your elbow. It's more safe. Okay, and then, yep, what I briefly mentioned earlier, avoid touching mouth, eyes, and nose, because the virus are very tiny, it's microscopic. We have no idea if it's in our hands, so just don't bring our potentially dirty hands near our face. Now, I mentioned that the best practice is to just stay at home, but I know it's very, very hard to stay at home completely. We need to go out sometime. We need to buy groceries. We need to buy snacks. We need to just go out to enjoy the scenery. So when we do go out, there are some precautions that we need to take. The first one is to mask up. Now, a lot of people do the right thing. They do wear they do wear masks, but what sometimes people got wrong is how to actually wear the mask properly. We need to make sure the mask cover completely our nose, mouth, and chin. So some people left out the nose still poking out. It's not right. And some people just forget and lay it down the chin, and it's also not proper. So if you want to go out, mask up and make sure it covers your nose, mouth, and chin. Another piece of protective wear is face shield. It's very popular now. What it does is it gives you an extra protection. Underlined on the extra protection. So face shield is not a replacement for mask. You still need to wear mask. Face shield will give you extra protection if you wear mask and face shield together. But if you only wear the face shield alone, it doesn't give you much of a protection because the sides and the bottom of the face shield is completely open. So you're putting yourself at risk. Okay, so remember your mask, and also remember to keep your distance. This is what we call physical or social distancing. Keep your distance around 1.5 meters around each other all the time. Because remember, the virus can also spread via physical contact. So by maintaining your distance, you are limiting yourself to those direct contacts, okay? And then another thing, like one of you mentioned in the previous answers, when you go out, bring hand sanitizer with you. The best way to clean your hands is, of course, with soap and water, but sometimes when you go out, it's hard to find it. So until you can find soap and water, hand sanitizer is a pretty good backup for that. So you can use hand sanitizer, and then when you finally find a clean bathroom example with a sink, with a soap, you can then wash your hands properly with soap and water, okay? When you go out, all of those 3 components that I just mentioned are important. All 3, not just 1, not just 2, all 3. So some of the common mistakes is someone wear a mask and they feel completely protected. This is misleading because even though you wear masks, you still need to keep your distance, you still need to keep good hand hygiene. So all of these three components are equally important. Okay, now I know COVID-19 is a new disease. The information about it keep developing rapidly. The authorities keep updating the protocols and new information, new facts. So maybe sometimes it feels hard to keep up. But what you need to remember, if you confused on where to go, what to do, where to look for information, just look up to these two. Go to the channels of either our health ministry or the World Health Organization. Those two are the guaranteed most reliable sources for everything COVID-19 related. My message, and a bit of a warning, is please be critical and careful on consuming the news on the internet, because not everything on the internet is true. Not everything in the internet is made by person who's reliable, who know their stuff. So yeah, just go to these two main sources. They are the safest and easiest source of information. And if you do want to read some news, be careful, be critical. Just don't take the information the way it is. You still need to think whether is this true? Are there other motive? Is this a hoax? So yep, be careful out there. If you need to ask somebody, ask your doctor, ask your family doctors, or maybe you can just ask me in this session. I'll be happy to help and answer some of your questions. Okay, and now let's play another game. Let's play a quiz. Go to joinmyquiz.com. We're gonna play for a bit. Okay, so students, please go to joinmyquiz.com. I'm gonna pull up the password in a minute.
What is the code, Sifa? Okay, here.
Yeah,
Quizzes.
quizzes. So go to joinmyquiz.com and enter the game code 440435.
So all the students, you are all supposed to and expected to join the quiz. And don't forget, there will be 50,000 rupiah at the end of the quiz for those who are lucky enough and have really the best answers. Thank you.
The highest score will get a prize. So
Yeah.
Yes.
okay, we got Ririn, Veronica, Sifanya, Pasha.
It's so fun.
We got 13 people, 14 now. Come on, come on.
Wow, it's so fun.
$18 people.
18. Come on, guys. We're still waiting for you. Romo, you can also join the quiz, so the prize will go to yourself.
Can
You-
I
you
join
don't
the
need to
quiz?
pay. So you
Will
don't need to
I?
pay for anyone.
Will I get a 50,000 credits if I win?
How many of
I
them?
join. I join.
Okay, you
Yay.
join. Yeah, good.
So
Thank
I
you,
think
Miss Lydia.
the prize for me.
The prize will be for you, and then you distribute it to your students.
Come on, students.
How many of them now?
21.
21. Okay, okay. We still wait for other students to join. John, is
Already
that you?
joined.
Oh, okay,
Yeah.
John. Okay, Pang. Okay, what a name, Pang.
Pang,
Pang.
Sebastian.
Pang.
Oh, okay, Pang, Pang or Pang. I'm
Pang.
sorry. So, 22 other players are here. Okay, 23 now. Still wait for 5 or is the other?
Maybe let's wait a bit.
Yep, yeah.
24.
We wait a bit. Yeah. 24 now. We still wait for 4 people to join.
Mhm.
Yeah. We still wait for 4 people to join.
Miss Shiva,
Yeah.
are there any students that want to enter the room meeting? Maybe because you are host.
Oh, right. Okay, I wasn't aware of that.
Yeah,
That's
because
all right.
So that's
there-
probably my bad. Okay, there are 3
it's okay. It's okay.
people. Oops. Sorry,
Oops.
students.
Sorry, students.
Okay.
Sorry, students.
We find the
Oh,
problem.
no.
We
We
already
find-
realized that you are host.
Yeah.
Yeah,
I
we
knew
have.
I'm host, but I totally forgot that now I'm in control for participants.
That's all right. It must be so bewildering for you too, because you have to present and then you have to accept
Yeah,
everyone,
yeah.
which is
Okay,
really, really
I
hard.
hope they could still watch from YouTube for the
Yeah,
program.
they can.
Yeah.
Okay,
But at least
okay.
they can enter the quiz because it's so
Yeah.
important for them to get 50,000
Yeah,
to
okay.
buy the data for PJJ.
Oh, sorry, students. My bad.
That's all right. We just need to give them more time, for
Yeah,
the new students to enter.
No worries, no worries.
We have 25 of them now.
Yeah, so for those
and-
who've just recently joined, just type on joinmyquiz.com and enter the game code.
Yeah, we still have time. No worries.
$27. $28. Are there any others?
We have 32 participants in Zoom, but
Okay.
we
We still have
I'm not
30.
joining.
Yeah. Oh, you're not joining. So 31, and then we
Okay,
have
okay, yeah,
28
31.
here. So we still need
Okay,
3 more people to wait, or we just.
okay.
Oh,
Okay, that's
29.
another one.
29. Right.
Wait for another 2.
Another two. Come on. Okay, Tati, just one more.
Yes, one more.
For the students, don't forget to turn off your microphone.
Okay, I think that's everyone now. Okay, I'm going to start.
Okay.
You guys can answer on your own pace. It's getting competitive.
I think I am the winner.
Oh. Oh, Zephania is climbing. Oh no. Come on, come on. Go, go, go. Fight for first place. Rachel is climbing. Oh, Zephania again.
I'm done.
Okay, let's wait for everybody else then.
It is very fun. Wow, Kalista ya.
I am runner up. I am runner
Oh,
up.
okay. We're going to wait for 4 more people to finish up.
Good.
Okay. Done. So the winner is Kalista. Congratulations for coming up first place in this quiz.
Is
Congratulations. Okay, now maybe let's review the questions. Just quickly review them. So first question, it's easy. COVID is caused by virus. Yep, and common COVID symptoms include is all of the above. Is the common symptoms are fever, cough, difficulty breathing. Okay, so all of the options are true. Number 3, you can have COVID-19 without having symptoms. This is correct. This is what we call asymptomatic because they are still infected, but they're not showing symptoms. And that's actually very common in COVID-19. And most of the spreaders are either the one showing no symptoms or having only mild symptoms. Okay, when you sneeze or cough, you should cover your mouth with your elbow or upper arm, all right? Your elbow or upper arm, because if you use your hands will be contaminated. Number 5, the correct way to wear a mask is the last one. Is when it covers your nose, mouth, and chin. Number 6, better option to clean your hands is, of course, water and soap. Okay, just use hand sanitizer when you cannot find water and soap. Number 7, this is a tricky one. Is this person well protected? Do not let the face shield fool you because this person does not wear face mask. So that means this person is not well protected. Even though you wear face shield, you would still need to wear a mask. Number 8, are these people being careful enough? No, not enough. What they done right is they properly do physical distancing. That's good, but they're not wearing face masks, so it's not enough. You need to always remember that 3 things when you go out: mask up, do distancing, and also keep your hands clean. Okay, so the good thing is these 2 men are distancing, but it would be better if they wear masks. Are these people practicing safe travel? Yes, because they are distancing and they are wearing masks. Okay. Number 10. This is also a good example of safe travel. They are properly distanced, and also the 3 of them are wearing face masks. Number 11. Should you watch a movie in the cinema right now? No, please just watch something at home. There are plenty of streaming services. Please don't go to the cinema right now because the cinema is indoor, crowded, and as much as the building manager or the cinema manager tries to clean or the surfaces, there's still going to be quite a high chance that the seating or all the services are contaminated. So please do not go to the cinema right now. Just wait for a bit, okay? 12. Is going to the beach right now is a good idea. No, it's crowded. If it's crowded, it's not a good idea. Number 13. Which restaurant has a better health protocols? Sorry, this is quite small, the pictures, but it's the one in the left. I hope it show up better in your device when you doing your quiz, because the one in the left, the people are sitting at a distance, while the one on the right, they are just sitting together ever so closely, and even the server doesn't wear mask. So this one is risky. Number 14, which sport is safer to do during the pandemic? So the first picture in the left, it's actually two people, mom and her son, playing badminton in front of their house. The other picture is kids playing soccer. The one that is safer is, of course, badminton, because it's only comprised of two people, less people, no physical contact, no direct contact, and it's just in front of their house. It's not crowded. Okay. Number 15. Are these people exercising safely? This picture is taken in Gelora Bung Karno. No, they're not practicing safe exercise. They're not distancing. They're not wearing masks. Next, is this a good example of physical distancing? Yes, this is an example of a school in Korea. They're doing some examination. And this is a proper arrangement of the physical distance desk for students. Which traditional market is safer? Safer one is this one in the right. Sorry for the small picture, because the one in the right, the vendors are actually seated at a distance, and the shoppers are kept at minimum, so it's not crowded, as opposed to the one in the left. Number 18. Are these teenagers being careful? No, they're going to the mall, not recommended. They're not distancing, they're walking close together. None of them are wearing masks. So these teenagers in the pictures, they are not being careful. Number 19. Is this woman shopping carefully? Yes, this is a good example. If you want to go shop, go outside your house and shop. This woman is being responsible because she keep herself on a distance from another shoppers. She wear a face mask, and also she wear a face shield for extra protection. So it's a good practice, okay? The last question, number 20. Are the shoppers practicing good health protocols? No. This is the opposite. Okay, I know this question is kind of tricky because the shoppers in the picture are actually wearing masks. But remember what I told you, that when you go out, there are three aspects that are equally important. You need to wear masks, you need to do proper distancing, and also you need to keep your hands clean. So you cannot just wear masks and then ignore the other components. So yeah, this question is for me to trick you guys. But we got 5% that actually correct in answering this trick question, so congrats. Okay, I think that is all for me. Is there any questions you want to directly ask while I'm still here? I guess we still have like 5 minutes.
Yep. Yep. Thank you, Ms. Assifa. What a presentation! It's a really good presentation. It's so
Thank you.
yeah, it's so insightful, it's knowledgeable. So Ramajan, please, you do the Q&A and session.
Thank you very much, Ms. Assifa, for your presentation. It's very, very informative and very fun to us. So, student,
You're welcome.
I give you all the chance to ask Ms. Assifa about her presentation about stay safe from COVID-19.
Yeah.
Who will be the first person?
Maybe not only question if they want to give their opinion about COVID-19. I think
Okay,
they can
it's
explain
possible.
their opinion, right?
Yeah.
Yeah.
It can be anything.
Yeah. Come on,
Any
guys.
questions or opinions?
Or you want to
Go on.
ask opinion from Miss
Who will be the
Assifa? You
first?
can do that.
Don't
You
forget,
can
you also
ask-
have 50,000
think
rupiah
50,000.
for the best opinion.
Someone raised their hand.
Okay.
Eva?
Eva.
Eva, okay. Go on, Eva.
Itu I have an opinion about
Have
COVID. I think the reason the number of patients who have the virus is high is because of mass panic.
Yeah. That's one of the reasons too. So do you want to elaborate about the mass panic?
Eva,
Because
do you
I
want
agree.
to elaborate?
Hello, Eva, go on. If you still have something to say. If you still have something to say, go on.
About
Eva?
mass panic?
Yeah.
People buying masks and
sanitizer.
yeah, and then try to wait try people buying masks and gloves and hand sanitizer, so people make a profit out of it.
Yeah, I agree. That is one of the problem. One of the problem, just like you mentioned, is mass panic. People panic and they make bad decision when they're panic, like hoarding masks and hand sanitizer, and that actually contributes to why COVID-19 is so widely spread in our country right now. So that's a very good opinion. Thank you, Eva.
Thank you, Eva. That's right. People make bad decisions when they are panic. Go on.
Is there any other?
Pang,
No,
maybe?
that's it. Thank you.
Okay.
Pang or Wilson, Maria Regina. Where are you guys?
Okay, we have Marcelino.
Okay,
Okay,
Marcelino.
Go on, Marcelino.
I have a question about the coronavirus. The question is, can people without symptoms spread the virus too? And what is the cause?
Yeah, very good question. So people without symptoms can still spread, and that's why it's very tricky to combat coronavirus, because if people have no symptoms, they're not aware and they cannot have proper measurements to not spread the virus around. The reason why is honestly still a mystery. We don't know why those asymptomatic people can stay infectious, can spread the virus around. So let's wait and see, because scientists are still working on this virus. They're still learning and researching about this virus. Maybe we will have an answer in a month or two. Let's see. But for now, it is still quite a mystery. So that is a very good question, because That is one outstanding question that even scientists are still trying to figure out. Okay, hope that answers.
Good answer, Marcel. A good question.
Good question.
Thank you.
Okay.
Anyone?
Next.
Next.
Come on, guys. Kalista, maybe?
Kalista, the
Kalista,
winner of the quiz.
I think you have prepared the questions, some questions.
Yeah,
Okay, come on, Kalista.
Hello,
I have
Kalista.
one. Hello, Miss. I have one
Hello.
question.
Yeah.
Can the doctor's personal protective equipment prevent transmission when treating COVID-19 patients? If so, why did so many doctors die from COVID-19?
Yeah. Okay. Good question. So, proper protective equipment will protect the doctor from COVID-19. And what I meant from by proper protective equipment is you wore a hazmat suit, the one that looks like an astronaut that actually covers you from head to toe. And then they wear 2 layers of gloves. They wear mask, and the mask is different with what we use or what we buy from the mini market or the the cloth mask that we normally use as a community. The masks that they're using are medical grade, so it is more safe for them, and they also wear goggles. So the protective equipment that the doctors are wearing should be enough to protect them if it's worn properly. And if you meet a doctor or ask them, there are actually very strict protocol on how to put it on and how to put it off. So it's not just about what they wear, but how to wear it and how to take it off. Another good question that you mentioned is, so why does our doctors keep dying? It's very sad. The main cause is they sadly are not wearing enough protections, because PPE or personal protective equipment, it's quite expensive, and it may be not distributed equally across Indonesia, because Indonesia is a big country, right? So maybe the hospitals in the rural areas, they don't have the same access to PPE as the doctors in Jakarta, for example. That's one of the reasons why there are some doctors that still dying even though they wear PPE. Another reason is, and this is not a good example, okay? There are people that lie to their doctors. There are people that are not honest when the doctors are treating them. For example, when the doctor said, okay, what are your symptoms? Do you have fever? Do you have cough? When the doctors ask a patient about their symptoms, if they lie, and the doctor thinks, okay, this person do not have fever, this person doesn't look like someone who has COVID, and then the doctor lower their protection, that's when the doctor got infected. So if you feel sick, don't be scared. Just go to the healthcare facility and please be honest with your nurse and doctors, because it's important for you and also it's important for them. They need to know if you potentially have virus in yourself. Okay, I hope that answers, Kalista.
Yeah, Kalista, that is the answer for your sad question. Yeah, thank you, Miss Ipa.
Another students, William maybe, or Charles. Come on. Grace.
Who will be next?
you want to give your opinion, Grace, about COVID-19? Because COVID-19 has so many impacts, bad impacts, not only for our healthy, but for economic maybe, and then for our social, something like that. Okay. So, okay, come on, guys. If you want to give your opinion about COVID-19, go ahead, say something, speak up. Grace, I know you have prepared about this material. Come on.
Don't be shy. It's okay.
Yeah.
Come on.
We are here
Oh.
to learn.
Yeah,
Side-
or
side-
Rahel or Grace. Up to you. Rahel,
Grace,
Grace, Maria Regina. Rahel, do you have opinion, a question for Miss Sifa, Jose? Can we still have 15 minutes left, I think, right? So please, come on. Ririn, do you want to ask or giving your opinion?
Giving opinion.
Okay, giving your opinion.
Nice.
okay, go on, Rin.
The world has shifted so much after getting hit by COVID-19. People cannot move around and work. Economies get frustrated, and will take some time to recover. So many people have no job and food on the table. In the other words, stay safe, healthy, and social distances. Let us pray for this pandemic to go away and get the vaccine as soon as possible.
Okay. That's a very good message. Yeah.
Thank you, Ririn.
The effect of COVID-19 is very devastating. It's not only to our health, it's to our economies, our jobs, our education. So, yep, important to keep staying healthy, keep social distancing, and also pray for the best that this pandemic will end soon, that the vaccines and the cure for this disease can be discovered soon. Thank you.
Okay. Maybe I want to ask you something, Miss Assifa. If
Yeah,
I
yeah.
go to some places, maybe should I wear gloves?
Glove.
Yeah,
Okay.
wear gloves to protect my hands.
Personally, I think I don't recommend it because even though you wear gloves, you still be touching stuff with your gloves. For example, if you're going to supermarket, okay, you're wearing gloves, you grab a box of milk, put it in your cart, and then there's a text message, and then you answer the text message, you touch your phone with your gloved hands, and that glove is already contaminated. So I don't really recommend to wear gloves, but I do recommend to just wash your hand as frequent as you can. So even though you touch something that's contaminated, you are clean now. That's a good question.
Because last month I bought some gloves and then I wore it because I thought that the gloves could be protect my hand.
Really, you buy some gloves.
Then now I know. Thank you for the information.
You're welcome.
Any other questions, students?
Okay. And then
Or opinion?
Cedric, do you have opinion or question? Daniel, Raven, Candy, Virgie. You know Virgie is a smart student in my class.
Okay, go Virgie.
But I don't know Virgie so calm.
It's Sai Cat.
Come on, Virzi, give your opinion,
where-
or
where's
you want to
Virzi?
ask something?
Be brave, be
Where's
brave.
Virgi? Yeah, be brave. Where's Virgi?
Virgi, turn on your
Virzi?
microphone and speak up.
Yeah, come on. Ask something to Miss Sifa.
I don't see Virgi. Where is the Virgi? Where is he?
Virgi,
Or any other students want to raise questions?
Could be
We
questions
have
or opinions.
we have Daniel, we have Jose here, we have Virgi,
Pasha, maybe?
Olivia, Tiesco. Tiesco, do you want to ask questions? Or Cedric?
Yeah.
Okay,
Tiesco.
Tiesco, go on.
I have
Good.
one question.
Good.
Okay.
What is the difference between self-isolation, self-quarantine, and physical distancing?
Okay. So, yeah, there are many terminologies that can be confusing. The first one, self-isolation and self-quarantine, are basically the same. It means you isolate yourself or you quarantine yourself. It's the same word from other people. So when you're staying at home or even when you're staying just in your room, that's called self-isolation or self-quarantine. What we call physical distancing is more of a when you're outside. Okay, so self-isolation and quarantine, that means you're inside your house or apartment or whatever building you live in. Physical distancing refers to when you go out, when you walk, when you shop, when you're out in the public, when there are other people around you. That's the main difference.
Okay.
Okay.
Thank you for the question. Thank you.
Thank you
very
for
much
the
for the
question. That's a good one.
Yeah,
'Cause,
I
yeah,
think we still have one questions.
Yeah.
One student.
one burning question.
One burning questions. uh, students, because for giving your opinion or question, you still have a chance to win 50,000 rupiah. So go. We still have one spot for any questions or opinion. Go
Yeah.
on.
Mona? Grass? Come on.
I got Eva raising her hand again.
Okay. Go.
Okay, Eva, go on, Eva.
Go on.
What do you think about new normal?
What? Okay. What
That's
do
a
I
hard
think
and
about
tough
new
question,
normal?
Sifa.
That's a hard one. And this is my personal opinion, okay? I don't think new normal means go back to normal. So I think we would need to adjust to the COVID-19 situation for a long time. Personally, I think for our case here in Jakarta, in Indonesia, I think it's too soon to actually apply new normal because the COVID cases are still climbing up, and up. So in my personal opinion, we still need to take this seriously. We need to self-isolate. We need to do physical distancing. We need to do extra health protocols and measurements to make sure we can manage this COVID-19 pandemic before we can actually go to a new normal. That's my personal opinion. But this is a very good question because it is very complex. If my opinion is based on health perspective, but the reality is everything is interconnected. Health is also connected with social life, is also connected with economy. So we should do the best we can to keep ourselves healthy. And let's pray that our leaders, our governments made sound decision on how to balance between health, economy, and social aspect. I think that's for me.
That's a really, really good
That's the
answers from
dilemma.
you.
That's dilemma.
I know. That's a
Uh-huh.
really tough question from our students. But we
Yeah.
are happy that you answer all the questions and also response to opinions that our students raise during these sessions. I think I'll give it back the sessions to Ramajan. But before that, I thank you very much, Ms. Sifa, for joining us today, and also for Ms. Hung, who watch our class from Melbourne. She's still in Melbourne. Thank you very much for joining us, Ramajan, and
Yeah.
also Miss Lydia. Time's yours.
Okay, Miss Shiva, thank you very much for everything. Yeah, I know you are very busy with your activities, with your job, and I already heard that you will go to Denmark tomorrow. But
In a couple of
Yeah.
days.
yeah, in a couple of days, but you still have time for
Yeah.
us for explain about stay safe from COVID-19. Thank you so much for your time, everything you already give for us.
My
Yes. Right.
pleasure.
And also safe flights for tomorrow to Denmark. That's a
Okay.
quite long journey, I think.
Mm.
And then don't forget, if you have any holiday,
In Depok.
you'll come back to Indonesia. Don't forget to visit us here in Jakarta, because she
Yeah.
lives in Depok, Romo.
Oh yeah, I already heard about it.
Yeah, yeah.
Yeah, safe
So-
flight tomorrow and keep going on your duty, on your job.
Yeah.
Okay, thank
Yeah.
you very
Thank you very
much.
much. Do you want to say something for your students, Romo?
I think
We have to thank you, all the students also here.
yeah,
Thank you
students,
very much.
thank you very much for your time. Yeah, I know right now in Indonesia we already in 3:17 p.m. 17 p.m. But you
Still awake. Yeah.
still awake and bersemangat ya.
Yeah.
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 Thank you very much for your time, your data, your packet data.
Okay. Yeah, your data, right? Okay.
Thank you very much.
Okay.
I think all the information that Miss Siva gave to us today sangat bermanfaat ya. What is in English? Sangat bermanfaat. Very useful, very
useful.
yeah, very useful. And I hope you will improve your English, not like me that very poor in English.
Don't say
But
that.
like
Your English is okay.
And Miss Siva, go on with your English. Practice it every day, and I believe, yeah, practice make perfect. You will be improve your English.
Right.
Okay, Miss Lydia, do you want to say something to your students? Or me?
Thank you for your time, guys, and thank you for your time, Miss Siva. Okay, do not kapok in bahasa. Thank you, and safe flight to Denmark for your activities there and your job there. Thank you.
Okay, thank you very much. Thank you, Mrs. Sifa, safe flight for tomorrow. Thank you for Ms. Sung for joining us today. Thank you all the students today. Hopefully thank you for all students. Hopefully you learn a lot today. Maybe someday you will be like Ms. Sifa, learning, study about virus, biological things, and also maybe to work abroad like her. So see you in the next sessions, next 2 weeks, and bye-bye.
Bye.
Bye bye.
Thank you. Thank you.